Meeting. If you would, we will turn our attention over to Dr. Farmer, and he will give us the Pledge of Allegiance, and then afterwards have a moment of silence.
Good evening, everybody. Charles Farmer, the principal at Freedom. I want to introduce Mr. Adam Mumrian, and Amanda Nunez, and Dr. Nunez. That's our administrative team. I'm partial. I think we're probably the best administrative team in the district, but sorry to my colleagues. Nonetheless, y'all join me for the pledge. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Y'all remain paused for a moment of silence.
Thank you. Thank you, Dr. Farmer. There are no good news awards on tonight. We will move all of those to September's meeting, so thank you for that. So at this time, if there is anyone for public input, we have a podium available. Remember, if you are speaking for public input, you must be a resident of the Franklin Special School District. And also, we would ask that you would limit your comments to 3 minutes, please. So if there's anyone who wants to speak, now is the time. No, just... But you do need to state your name.
All right. Hi, I'm Brittany Sierra. You may have received a few emails from me last week wanting to talk about temporary mask requirement for my kiddo, first grader at Liberty. We love Liberty. So that's why I'm here today. Our two full-time working parent family was so grateful that Franklin Special announced all of the COVID protocols last summer as we went back to school. I work at Vanderbilt. My daughter's been at Vanderbilt daycare with the then 5-year-old who had been doing all the things all summer. It really worked well for our family. We felt confident, and we chose to go in person for that kindergarten year because Franklin Special was going to do all the things. So we happily, joyfully, even though I have a teaching degree, homeschooling doesn't really work for our family, opted to go back for in-person. So thank you for that. And then we kept going, and vaccines came. Yay, science. Thank you, science. There were some restrictions lifted, making for a pretty awesome summer. But I think it wasn't up until a few weeks ago when the mask optional decision, I was indifferent until then, because I truly thought surely we're going to revisit it until at the end of, once we get closer to the first day of school. I think it was a denial that we would actually get to have a day of school without having some kind of discussion about this beforehand. Then the Delta variant started picking up here in the US and locally here in Middle Tennessee, and again, I truly thought, okay, surely it's coming up. Because y'all, I know you've read the headlines and received reports. We are, the medical and scientific experts all over the country and here surrounding us in Middle Tennessee have been getting louder and louder in their advice, which is we need to get vaccinated and we need to wear masks. Unfortunately, our under 12-year-old kiddos can't get vaccinated yet. But what we can do is have a temporary mask requirement to keep protecting those in our community that are most vulnerable. Like I mentioned in the email, I'm probably going over my time. What I think is happening is that the Williamson County Special session tomorrow that's going to talk about it. Maybe y'all to make a decision tonight and wait for them, but I say take the lead. Our specific community demographic statistically has worse outcomes with this thing. My white upper middle class child, she will probably be fine. She has 2 parents that have paid time off, can take care of her. That is not the case for everybody here in Franklin Special. Please don't wait for Williamson County. Let's take the lead. Do a motion for new business or vote. I'm still learning the whole Robert's Rules of Orders thing and how boards work. Let's do this tonight so that we can keep our kiddos safe and the rest of the Franklin Special community starting tomorrow. Thank you very much.
Thank you. Anyone else who'd like to approach the podium?
Good evening, FSSD families and staff members. My name is Angel Stansberry. I have 2 young boys at Liberty Elementary. I come here today as a concerned mother of 2 boys who currently attend Liberty. I also come to you as the sister of a doctor who is currently overwhelmed while caring for COVID patients with the Delta variant in the intensive care unit at her hospital. At the moment, the Delta variant is spreading voraciously throughout the US and the world. Tennessee is currently ranked 6th in the country for high rates of infections and subsequent deaths, the other 5 states being much larger. This new variant has seen 20% of infectees being children. In fact, the pediatric ICUs at both St. Thomas and Vanderbilt reported this morning that they were full to capacity. Dr. Piercy, our Tennessee Health Commissioner, predicts that all children's hospitals will be full by the end of this week. Hand sanitizer, alcohol wipes, and social distancing measures are all well and good, but they are mitigative efforts at reducing the spread at best. Such measures can only be truly effective when enacted alongside common sense protocols which mandate face coverings and temperature checks upon entry into the school. This is not about anybody's rights being taken away, and this is certainly not a debate about politics or religion. This is about following CDC recommended guidelines and adapting to new scientific data and statistics of the rates of infections and adjusting those guidelines accordingly to accommodate a better safety regime for children, faculty, and staff at FSSD schools. Personally, I begin law school next Monday. It is not ideal that I have the boys home while I try to prepare my case briefs and attend class. But I feel like I'm put in this position by policies which put my children at high risk for infection. We will now need to pay for tutors, and my husband and I have decided that we will either move to Davidson County or keep our children home on an online curriculum. All of this simply because of a lack of common sense safety protocols being in place at FSSD schools, rendering my unvaccinated young boys at risk for contracting this deadly variant. Now, with pediatric ICUs approaching capacity, should we risk their health and send them into a single building school where over 90% of children are unmasked and almost all of the student body are unvaccinated? Furthermore, should they be taught by staff who may well be vaccinated but are unmasked and thereby susceptible for transmitting the virus between unvaccinated students? Our children are not expendable. Our children are in fact irreplaceable. They are still growing and their lungs are still developing. What if they ended up with permanent lung damage, extensive scarring, or a chronic lung ailment? What if they required hospitalization and ICU beds were full? What if my children succumbed to their illness and died, like 2 children in Shelby County already have? Who would be medically and legally liable for their deaths? More importantly, how would my husband and I ever forgive ourselves for putting our children's lives in danger by relying on an elusive honor code, which quite frankly no longer exists? We can no longer trust our school board. We can no longer trust our elected officials, namely Bill Lee and Cameron Sexton, and frankly, we can't trust any of our fellow parents to simply do the right thing, the safe thing, the considerate and unselfish thing, to simply put a mask on their child.
Ma'am, thank you. Your 3 minutes are up. Appreciate it.
Thank you.
Thank you.
Thank you very much. My name is David Madeira. I am a parent of 3 here in Franklin, 2 of whom attended Moore Elementary last year, kindergarten and 2nd grade, and who we have been hoping to send to Moore in 1st and 3rd grade this year. Like the woman who spoke just before me, a little unsure about that decision at this time. My concern right now is that politics has overtaken a conversation on an issue that need not be political. It certainly need not be partisan. We have a wealth of data at this point, 18 months into the pandemic, that demonstrates the efficacy of masking. We have the guidelines suggested by the CDC and the American Association of Pediatrics, all recommending that children and faculty and staff wear masks in schools this year, regardless of vaccination status. Just today, a group of doctors, pediatricians, medical staff released a statement here in Williamson County advocating that the school districts follow these same guidelines. It seems to me that it is the sensible thing to do to at least apply a mask requirement until we either see the Delta surge begin to decline, or until our children are able to be vaccinated. That seems to be an easy decision to make, to at least put a temporary mask mandate in place. My kids attended Moore Elementary last year. We were so impressed with the way that the school handled these things. They had a great year. They did not have to shut down at home. Their class did great. My kids, I think they each maybe complained one time about wearing masks, and it was as simple as, I wish we didn't have to wear this. We talked about it, and they were fine. I think they said it maybe once over the entire course of the year. They learned a lot. They met their learning goals. They had a great time. They developed relationships with friends. Masking last year did not inhibit their learning or their social life in any way, and I cannot possibly see how at least a temporary mask requirement would have suddenly a significant detrimental effect on their learning this year. And in fact, having to shut down their classes, quarantine at home, revert to virtual learning, and even worse, contracting COVID and possibly ending up in the hospital would be significantly more detrimental to their learning and their health. So I would absolutely recommend that you all make this decision quickly, at least temporarily, until our children can be vaccinated or we see cases decline in our area. Thanks so much for hearing me.
Thank you, sir.
My name is Brandi McCoy. I have 2 kids currently in the district. I live on Braylon Circle in Franklin, Tennessee. I've had 3 kids go through the district, and one that's at Franklin Elementary now and another that is at Freedom Intermediate. I am also a sub within the district, and I just want to give a different perspective on this issue. It's ironic that 2 of the 3 speakers that came up tonight removed their mask when they were speaking, and yet we are requiring our teachers, or did require our teachers last year, to teach 20+ children in a classroom with a mask on the entire day. So something to consider. I am not for my child wearing a mask. I have 3 girls. 2 of them had impetigo this year on their face. We had weeks of treatment. We also had eye infections. We had styes that I attribute to wearing the mask. And I just want to have the choice to not have my kids wear a mask all day. I substitute in the school, and I see what these masks go through. The cloth masks are touched constantly. These are not adults, these are children. They are taken off, they're put back on. These kids in these schools come to school with cloth masks that probably weren't washed. I mean, I can say that I don't wash my kids' mask every day when they come home from school. I don't have time. I'm raising three children. So I know we have disposable masks. They're wet. I've changed them out multiple times as the substitute teacher in the classroom. They're sneezed in. It's constant. It's kids. They're kids. And this is not a doctor's office. They're not adults. And so I would like for you to take that into consideration when you're considering the mask mandates, and just let parents that do not want their kids wearing masks all day have the choice. Thank you.
Thank you.
Hello, my name is Lance Shelby. I live in Heath Place, have a kid at Freedom Intermediate and Franklin Elementary. And I would like to start off first by saying thank you to the teachers and administration, and to name names. We have experience at Franklin Elementary, Ms. Riley and her team there. We were so thankful that our kids could go back to school this summer when we had so many other friends that their kids did not. And, you know, I think this is probably the norm for the demographic, but we come from 2 working parents at home. There's no way we could have had a kid at school. And it would have been a real challenge for anybody in any circumstance to try to have a kid at home and try to work 2 parents working a job. So I want to say just a heartfelt thank you to everybody that made it possible to go back to school last year. We dealt with the masks. They were what was required to make the school year happen, and we got on board with it. It is very different now. I'm going to read some CDC stats, or actually CMS stats. I'll start with Williamson County. So currently, this is today, 1,126 active cases in Williamson County. That's 0.472 of the population. So less than half of 1% currently has COVID. That's the case rate equivalent to January 2021. However, the death rate now is 15% of what it was. And I think that's attributable to the vaccines, that everybody that needs one, wants one, everybody can get one except for kids. The current data shows that there are no kids transmitting this disease to other adults, at least not in any kind of fashion that would make it more scary than the seasonal flu or a cold. Here's some details from CMS. Age 5 to 11 is 4.2% of all U.S. cases. However, they represent 9% of the total population. There's 0% deaths in this age group. 0%. Now, that doesn't mean there's 0 deaths, but that rounds to a 0% death rate, which is significantly lower than flu, cold, lots of other diseases that we all face and we've never run from in the past. And again, I want to say thank you. We have options. If you are a parent that is concerned, you have the option to put your kid in virtual. You have the option to wear a mask. Protect yourself. We are all risk mitigators. I make decisions every morning when I get in my car. I'm going to wear my seatbelt today. I'm going to keep myself safe. We all have the rights and responsibilities to keep ourselves safe. We don't have the responsibility and rights to make other people do other things. And I was at this meeting last month, the school board meeting. It's the first one I've ever been to. I was impressed. And y'all talked about the summer programs and that there was 0 COVID cases, I think, that came out of the summer programs. I hope we take that mindset and mentality and continue it forward in the school year, saying that this is not a risk that requires us masking up our kids for another year. I guess that's part of my bell, right? But thanks again for teachers and administration that's made this happen so far this year.
Thank you, sir.
I'm going to sign in here.
Thank you.
My name is Brittany Rogers. I have one student currently in the FSSD, and my 3 other older high school students are also members of the FSSD staff over at Poplar Grove, next door. I'd just like to address a few things that have previously been said. Asymptomatic spread has not been proven, and it especially has not been proven in children. 5 million a 5 million person study in China proves that. There's 0 tracing of asymptomatic spread, especially in children aged 12 and under. Every adult who wants to get the vaccine has had access to the vaccine. So if this is about protecting teachers, they're grown-ups, they can be vaccinated. The children in Memphis who died and their deaths were ruled COVID deaths had comorbidities that made them very weak. Those children had been in the hospital, one for 7 weeks and one for 12 weeks, dealing with other comorbidities. They contracted COVID in the hospital. They were not out, they were very sick children, and that is not the type of population we are talking about in our daily classrooms. I don't think that the school district should shoulder the burden of the liability of a child getting sick. Parents shoulder that burden. We're the ones who make decisions about our children's health and safety. Parents can actually be trusted. No one wants their kid sick. No one wants their kid getting another kid sick. we've done a pretty great job of raising a really amazing population of kids. And to say now that we can't be trusted to make the health decisions and private medical decisions for our own children is absolutely absurd and insulting. Please, please consider the loss of support, the wedge that will be placed in the classroom again, the burden on teachers, the emotional and psychological burden that our children have already carried. And there is no reason, no scientific reason, no emotional reason, no political reason to make our children medical, emotional, or political pawns. Thank you.
Thank you. Is there anyone else before we close public input?
Hello, my name is Arya Withrow. I live on Gist Street in downtown Franklin. I have one daughter, Rose, that goes to Franklin Elementary, and I was coming just to listen. I wasn't planning on talking, but I feel really strongly about something, and I'm going to be emotional about it, and I'm sorry. But I have a daughter who already deals with so much anxiety and diagnosed PTSD and so many issues that I'm already dealing with. And the amount of baggage we came home with last year, with not only masks, but social distancing. And don't get me wrong, I know everyone was trying to protect our children, and I'm so thankful to you, Miss Riley, for everything you did for us. But I know no one was trying to cause any harm, but I cannot help but think what this is gonna do to my precious daughter again, whose hands are raw and bleeding because she's afraid if she doesn't wash her hands, she's gonna die, because that was the general idea of everything. And again, please hear me, I'm not blaming anyone, because her teacher, shout out Miss Parks, best teacher ever. But I feel like someone needs to talk about the emotional health of our children, because emotional health is just as important as any other kind of health. And I don't have the statistics to come up here and tell you all of that, but I just want to say from my personal experience that I have a daughter that is crying and worried and stressed because of the baggage we have placed on her at that time as a 6-year-old, and then a 7-year-old, or I'm sorry, 7 and now 8. And it's just too much. It is too much. And I don't want her to get COVID, but she's already had COVID actually, and she was fine. Like I didn't even know she had it, except I had it and I lost my taste and smell. So I want her to be safe. I want everyone's kids to be safe, but I also want what's best for them socially and emotionally and long term. And I know that not being allowed to play with your friends and sit on a rug and talk to each other and little girls holding hands and skipping is not what's best for so many kids. And that's all I want to say.
Thank you.
Hi, my name is Katiedson, and I have 2 children at Franklin Elementary, a first grader and a third grader. And I'm in a similar situation as the previous speaker. My son the last year struggled. He struggled on every front. Emotionally, he is now in counseling because of the isolation that was in place. And I know it was for safety. And yes, we still got COVID. We wore our masks. We didn't go into any stores. We FaceTimed. I FaceTime all my business meetings, and we still managed to get it. Our children were fine, thankfully. But he is now in counseling because he developed so many tics, and he has lost the ability to self-regulate emotions. The isolation factors alone from not being able to play with another child took a major toll on him. When he came home from his first day of school, I almost started crying because I said, "What was the best part of your day?" And he said, "Mom, we got to have rug time." And he said, "Mom, I got to play with all the kids at recess and go wherever we wanted, and I got to sit by my friend at lunch." And my son last year also developed an eating disorder where he couldn't stand to see other children eat because he wasn't able to interact with them. And we are now in counseling, and his counselor has told me that the past year has been classified as a traumatic event for our children. And yes, it is a hard situation, but it should also be put into the hands of the parents as to whether our children should wear a mask or not. And honestly, data has shown that the only true mask that will stop the COVID virus effectively is an N95 mask. And so these cloth masks are going to stop some things, but they're not going to stop the COVID vaccine, and I mean the COVID virus. And it's not helpful. Every single day my son came home with a soaking wet mask, and it was changed multiple times. And he also developed an oral fixation where now he chews on everything because he was so used to having a mask on his face. And I know it's exactly like what the previous speaker said. Everyone is trying to keep our children safe, but we do have to take into account their mental and emotional stability. It is not just their physical health. It's a whole package with our kids. And we're just focused on the science and the health of all this, but we also have to focus on the other parts of the health and not just the mask. We have to think about their emotional and mental stability as well. Thank you.
Thank you.
I'm Betsy Baxby, and I work at Liberty Elementary. I have a parent on speakerphone. Unfortunately, she and her child could not be here tonight. Ms. Gibson, you're on. Go ahead.
My name is Kayla Gibson, and my daughter goes to Liberty Elementary. She's in 2nd grade this year. I am fully vaccinated. My child is not yet because obviously she can't be, but she is in a mask. She will be in a mask the entire time. My concern is other adults and children not being in a mask at school. I've heard other parents mention like the social aspects of it, or that really isn't preventing anything. My daughter has a disability. She uses a power chair. She has health concerns to which she does not need to get COVID. It's likely that she would be in the hospital if this happened. And I don't have the option to homeschool her because I'm a single mother. So it's unrealistic for some of us as single parents, especially of a child with a disability, to homeschool our kids, to put them in a virtual school, which FSSD is not even offering virtual school this year, so that's not even a possibility right now. But some of us have to work. Some of us cannot stay at home, and we're doing everything we can to protect her. The masks do not affect anything socially. My daughter is nonverbal, and she is the most social child that I've ever met. I used to teach kindergarten. My child is extremely social. Everyone who can tell you that's in the school with her knows she's social. Her being nonverbal does not prevent her from that. Her wearing a mask does not prevent her from being social. It is important that we keep our kids safe. The CDC is urging schools to wear masks, and that's what we need to do because they cannot get vaccinated yet. And we as the adults need to be responsible and protect our children. This isn't going to affect them long term. And look, we need to be responsible. We need to do what's right for our kids and put the politics to the side, put religion, whatever it is that's like making you go anti-mask, put that to the side because none of that matters. What matters is protecting our kids. It terrifies me knowing that our hospitals are full when my kid would possibly need a bed and she has to go to school. And so I think it's important that we vote to wear masks to protect our children in the schools right now.
Thank you. Appreciate all the comments that have been presented to the board. We have time for one more, and then there's other business the board must address.
Can you hear me?
Yes,
Okay, my
ma'am.
name is Evelyn Rogers. I have a grandchild in Williamson County Schools. I just want to say that
Pardon? In what schools? Are you a Franklin special resident, ma'am?
Yes, yes.
Okay, thank you.
So the The masks are hurting our children. They need to see smiles. They need to interact. The masks are not a zero-sum game. They are really, I think last year we did not realize all the harm that these masks are doing, but they are hurting our children. Our children are being used as political pawns. The last lady, God bless her, she said it's not a political game, but it is. The CDC is not a medical organization, it is a political organization. There is zero evidence that the masks work. They do not. It's like trying to stop a mosquito through a chain link fence. In fact, it's stopping herd immunity. Our children need to be around this virus, actually, to develop herd immunity. Anyway, the death rate for children is 0.0003%. They're more likely to die in a car crash on the way to this school than to die from COVID. And the hospitals are supposed to be full. They're always pretty much full. That's how they're designed. So this scare rate about, oh, we don't have room in the hospital, they're always pretty much full. I don't know if you ever go to Vanderbilt or Children's Hospital, they're pretty much full all the time anyway. So let's don't hear that, oh, there's no room. If a parent wants his or her child to wear a mask, then God bless them, they should go to school with a mask, even though it's a ridiculous assumption that it works. But do not make our children and grandchildren victims of something that is unscientific, that does not work. This is a ridiculous thing. It's the same thing as if I said, okay, everybody that goes to the Franklin Special School District every day has to wear red or orange or purple. That's as scientific as that. It's stupid. And don't fall for this, please. Thank you.
Thank you. All right.
Allowing faculty and students to come back to school and see so many smiling faces. I couldn't believe how many of the teachers were just so glad to be at school and see all the same kids with the same smiles. So if you haven't heard any thank yous from parents tonight, I'm one of them. I have a kid at Moore and one at Freedom. God bless you. It was amazing. I'm so glad.
Now declare public input has been closed. And we will move on. That's my timer goes. We will now move on to reports and discussions. Dr. Snowden? Oh,
Construction report, Dr. Esslinger.
Okay, Dr. Esslinger.
Well, good evening, everyone. You have a construction report in your board packet. We have a lot of exciting things happening in our district. I'll welcome any questions if you've had anything you'd like to ask at this time.
Any questions for Dr. Esslinger?
Just a comment here. I was at Liberty yesterday and walked through and saw a lot of the work being done. Excuse me. Fantastic. Looks great.
I'm glad you came this week. But you're right, Mr. Stillings. It's an exciting time at Liberty. We're proud of that, and I hope the teachers will have their spaces they deserve. It's going to look nice. Yeah.
I was just going to say it's been great to see some of the improvements that have been done out here as well with Freedom. It seems like every school is having a little bit of improvement done, and I thank you for that.
Mm-hmm.
Thank you, sir. All right.
Okay, I think it's...
Teaching and learning?
Oh, I'm sorry. I thought she had...
Respectfully, sir, I'm going to postpone the spotlight until the September meeting. We'll hear about the summer learning camp at that time.
Well, we thank you for, and we look forward to it. Thank you,
sir.
All right.
If we could just get Liberty Construction to move on a little more rapidly. I know Ms. Patton believes that, and a lot of the teachers, but the ones who have those new spaces are really excited for certain. As we move into the discussion related to COVID and mitigation protocols, I think it's important to first of all acknowledge the anxiety that many parents feel as we return to school. We know the CDC has recommended a universal mask use of everyone in a school building. What you don't usually hear is that CDC also in their guidance states that localities should monitor community transmission, vaccination coverage, and occurrence of outbreaks to guide decision on the level of layered prevention strategies. Last school year, we found school data to be extremely important when analyzing COVID to determine if there was school transmission or if the virus was being contracted outside the school. For the most part, there was minimal transmission of the virus in schools. Could the low transmission have been due to masks? It certainly could, but there were other mitigation protocols being used at the same time. At this point in time, we've only had a day and a half of data to determine how COVID looks in our schools. If we begin to see a spike in cases and transmission, we can always change course. But to not have the data of our schools, which last year was extremely important, and there's no guarantee. I can't guarantee what the data is going to look. When it comes to COVID, it's been very unpredictable. As far as mitigation, and the COVID team is sitting up here, and Dr. Esslinger and Dr. Decker are part of that COVID district team as well. I want to talk about mitigation strategies, where we are with those, and then some other things, and then open it up for questions for any of the COVID team members. I think an important mitigation strategy we have to continue to ask and is parents to not send their students to school if they're sick. That's always been important. That's always been part of our mitigation protocol, but it's especially important during a pandemic. Social distancing strategies throughout our building. Is it perfect? No, it's not perfect. It wasn't perfect last year, but our teachers, I think, are doing a good job, our administrators, so that will continue to be part of our strategy. Respiratory etiquette. We're always teaching. Our teachers do, I know we do a great job teaching reading, writing, arithmetic, science, social studies, but they also teach a lot of different aspects to help children grow and mature. So respiratory etiquette is certainly part of the teaching that goes on every day. Proper hand washing, hand sanitizers available all over the buildings and in classrooms. Has been mentioned at this point, optional masking by our families and staff. By families, meaning they get to choose if their students are to wear a mask. Our custodial, transportation, and school staff are diligently providing routine cleaning and disinfecting and sanitizing practices. We continue to monitor students for signs of illness, and if we see, and I'm basically talking about any personnel at the school, and if they see signs, then they refer to a school nurse. Buses are using assigned seating. School nurses are also constantly monitoring for illness. We advise parents and staff to self-monitor and not to report to campus if they've been in close contact with a confirmed diagnosis of COVID-19 in the past 10 days or experiencing symptoms of infectious illness. We will continue to review these strategies to determine if and how they can be more effective. An extremely important mitigation protocol, has already been mentioned tonight, is the vaccination process, of which the school district has no control. We continue to plead and ask our community to consider receiving that vaccination. We plan to continue working with the health department to assist in contact tracing to identify close contacts in our school. We have weekly meetings with county and city officials to discuss trends in the community. We have weekly reporting to our families on the spread of the virus for staff and students at the end of each week. We want to be transparent with how COVID looks in our school. Our weekly COVID team meetings are held to review county, school, as well as district data. And then we will continue to monitor all the data available at the school, available at the district, so the district can change direction related to any and all the protocols. I'll open it up to questions for me or for any members of the COVID team to the board.
I do have a question, please. Do you think the State Department of Education is going to change their decision on whether districts can offer more virtual options? Because last year, we had a lot of freedom in what we were able to offer, and this year, they pulled that from us. What is your take on that? I know you can't read the future, but have you?
Yeah, well, it wasn't the State Department of Education. It was the State Board of Education who allowed the continuous learning plans, CLPs, to basically end. The CLP or CLPs were the things that was continuous learning plan that allowed school districts to use the virtual learning model. And we were extremely disappointed when we heard that that was going to occur. The State Board is a non-political, agency, but it also, as far as my understanding, that those board members are appointed politically. Now, I'm not saying that politics ended that virtual option, but we as school superintendents lobbied the State Board for continued use of that CLP so we could provide a virtual teaching and learning model. If I had to make a guess or be speculative in this, I would think that it's not going to return for this school year.
I have a question. Dr. Snowden, can you just share, for the sake of people who are listening in, who sits on our COVID team and helps make those decisions?
Sure.
And I also just want to reiterate that each district has been given local ability to make their own decision on this year on masks and the protocol. And our district does have a nurse in each building, which many districts do not. So we also have that in our favor as far as having appropriate staff to be involved with our students. But can you just share who's all on the team?
Sure. Dr. Decker, Dr. Esslinger, both of those are associate directors. Shelby Glass, who is over our safety and security and attendance and wears a lot of other hats as well. She's been also our liaison with the emergency management system and meets regularly with them, even though I'm in most of the meetings and they're usually through Zoom. But she meets also in person with them. Then Nurse Fisher is our district nurse, and she's also a nurse at Johnson Elementary. Lisa Chapman, who is is our coordinated school health. What is that? It's not a supervisor. Coordinator of school health. Excuse me. I knew I'd get it right there. And then Ms. Duke is our HR supervisor. So I think, do we have anybody else? That's So Susanna Gentry, sorry Susanna, didn't mean to leave you out. Our communication specialist is also a member of that COVID team. And we meet regularly. In fact, we met for 2 hours this morning. So it's not something, COVID is serious, and we understand that. And we meet and talk about the many different facets of COVID and how it relates to our school system.
Dr. Snowden, one of the questions that I received was thanking us that we were able to help with allowing some of the teachers and our just all of our staff have an opportunity to have time to be able to get the vaccine. Have we thought of doing that again for some of the new people that have come on that have not yet taken advantage of getting the vaccine?
We've not arranged that yet, but I think that I'm sure Shelby could put that on her list to see how possible that was, and we might could have I don't know, we'll just have to talk to the health department. I think that's a possibility to offer that opportunity to either those new employees or maybe offer the opportunity to those employees who didn't take advantage of that, the vaccine last year. And we don't know, we can't ask who's been vaccinated and who has not been vaccinated. Based on the turnout, and I don't remember those numbers, Shelby may remember, there was a significant number of our employees who are fully vaccinated. Nurse Fisher or Shelby, you remember about how many we had?
I actually went back and looked at your director
Okay.
of schools information, and in one period, it was over 400 of our personnel that was able to, this was specifically for the second immunization.
But you also have to remember that many of our employees didn't wait for that
Right.
vaccine
Oh, yes.
opportunity.
Right,
Many
right.
drove to Shelbyville, and I didn't say that. I think it's Shelbyville, right?
Yeah.
Went to different places to receive that. So you can't say, we can't use that number as the total number of employees who have been vaccinated.
Right,
We
right.
did, the folks that couldn't come to those because of previous engagements, we did arrange for them to get it with the health department shortly thereafter. They scheduled them to come and get it very simply.
So we'll work on that, see if that's a
Thank you.
possibility.
I've got another question. Okay, and this, I know we've talked about it, but this is more just to get it out there so other people know and understand. When you guys meet, who do you guys gather information from for these meetings?
I'm gonna ask Nurse Fisher and Shelby because they are the gatherers of information.
Shelby is well connected with all community partners, so I speak probably weekly or 2 or 3 times with the health department, but Shelby does with other agencies.
And I'm grateful for that because they can talk nurse and I can't do that. So that's super helpful. But we work with the hospital. We get information from the Williams Medical Center. We get information from emergency management. We share information and talk to our sister district, Williamson County Schools. There's obviously the health department. But there have even been meetings before where animal control and the sanitation department is on there. And we're talking about, is your staff low? Can the trash be picked up this week? What does that spread look like in your department? The streets department. I mean, it's very vast. All of the city administrators. I also just had my first quarterly meeting that I do quarterly during the school year with all of the area police chiefs. So the police departments, obviously our sheriff's department, we get information from them. So it's just data pulling from lots of different areas, never working in a silo. And if there's areas that I'm not thinking about or that Nurse Fisher's not thinking about, then someone that we're meeting with us will say, don't forget about reaching out to this person to get information. It's just constantly an evolving, constant communication, daily, truly. The meetings are regular, but the conversations happen daily. Thank you.
I've got a question. The CDC, we also look to them for guidance as well?
Well, I think everyone looks at guidance, and also, as the CDC will state, that, those are obviously guidance or guidelines for across the country. And that's why I think in their guidance it says different localities have to consider what's going on in their community. So yes, a lot of these mitigation protocols that we're currently using are recommended by the CDC. But I think you also have to make sure that you understand that their guidance is looked upon for the nation, and that's why, again, saying the same thing, but I think the locality is important as well, looking at data from the local level.
Dr. Snowden, one more thing that was brought to or sent to me was a thank you for our great communication. One of the parents mentioned that they were appreciative of the protocols that we have in place because she has 2 different children at 2 different schools, and we're able to share at each school what, in transparency, what has taken place over the course of that week.
I just want to thank the COVID team for not making these decisions in isolation, that we are using all the resources in our community, which is what we're required to do, and making decisions based on that. And I know as things evolve and change and whatever may come, we'll continue to make decisions, and protocols could change. They could go in different directions. But thank you for ensuring us that you're doing all the work that can help us feel confident in what's being done. So I appreciate that. I really do.
Any further questions for Dr. Snowden or the COVID team? Certainly thank you for all that you do and all that you have been doing and will continue to do. It's very much appreciated and certainly not taken lightly, and we do look to you for that guidance and appreciate it always and at all times. Thank you. All right, approval of the board agenda.
Mr. Chairman,
Oh,
Mr. Stanley and I had a conversation prior to the meeting, and I do agree with him. Item number 12, the policy revision on physical examinations and immunization, 6.402. I think there's some ambiguity in that statement, in that revision, and I would like to, we're going to talk about tabling it, but I'd just like to pull that item from the agenda and let us get some clarification from TSBA to try to clear up that seemingly it is ambiguous, and after I reread it, after Mr. Stillings brought it to my attention. So item 12 would be pulled if it's okay.
Yes, sir.
No other changes.
All right. Okay, so with that being pulled, is there a motion for the board agenda?
Motion to approve the board agenda.
Yes. Second, Robin. Any other, everybody approve? Thank you. Approval of the consent agenda, is there a motion?
I'll make a motion.
Robin,
I second.
Alicia. All right, everyone approve? Thank you. Business before the board, Dr. Snowden?
Yes, item number 1 is the new policy instructional standards. This is how 4.1011, I'm sorry. This is the second reading, and per TSBA Policy Department recommendation, several recent changes to state law impact the materials and content that can be included in classroom instruction. TSBA has created this new policy to align with those updated state laws. Adopting this policy is not required, as we stated last month. However, doing so would allow the board to show compliance with the new standards. There were no changes requested by the board upon first reading. We're recommending approval of the second reading.
Thank you, sir. Motion to approve? Mr. Stillings, is there a second?
Second.
Ms. Bell, any discussion? All in favor? Thank you. Dr. Snowden?
Item number 2, a new policy, summer instructional programs, 4.2041. This is also a second reading. During the past legislative session, laws were also passed. I guess that was actually during the special legislation in January that impacts summer programming. TSBA has provided a model policy to be adopted to include the additional summer programs that will be offered to students in addition to our traditional summer school. Certain factors, as outlined in this new state law, determine student eligibility for these programs. Boards have the discretion when determining whether to require the attendance of priority students in summer instructional program. If the board chooses to require the attendance of priority students, this information must be included in policy. There were no changes requested by the board in first reading. We recommend approval of the second reading.
Thank you, sir. Is there a motion to approve? All right, motion, Ms. Newman, second, Ms. Barker. Any discussion? Seeing none, all in favor? All right, thank you. Dr. Snowden?
Item number 3 is a new policy, enrollment in advanced courses, 4.205. This is also the second reading. Boards are now required to adopt a policy detailing how students can enroll in advanced courses. This policy must list objective enrollment criteria, including TCAP scores and grades. TSBA has updated their policy 4.205 that's up for adoption to align with this change to state law. TSBA also recommends that boards include the criteria of those courses offered by the district. We had no changes requested by the board on first reading. We recommend approval of second reading.
Thank you, sir. Is there a motion to approve?
Motion to approve.
Ms. Bell, is there a second?
A second.
Ms. Barker? Any discussion? All in favor? Thank you.
Item number 4, policy revision application and employment, 5.106. This is also a second reading. Recently passed, Public Chapter 211 allows the director of schools to hire individuals with a teaching permit if a teacher with a valid license is not available. TSBA has also provided language in their updated policy to clarify that this is an option. There were no changes on first reading by the board. We recommend approval of second reading.
Thank you, sir. Is there a motion to approve?
I'll make a motion to approve.
Ms. Newman, is there a second? Ms. Barker? Is there any discussion? Seeing none, all in favor? Thank you, sir.
Item number 5, policy revision, qualifications and duties of the director of schools, 5.802. Again, second reading. Also part of Public Chapter 211, which allows the director to hire individuals with a teaching permit if a teacher with a valid license is not available. Policy 5.802 is impacted, as the director of schools would be required to report potential misconduct by these individuals to the State Board of Education in the same manner that is done for licensed teachers. There were no changes upon first reading. We recommend approval of second reading.
Is there a motion?
I'll make a motion.
And I'll second.
Mr. Townsend, motion. Ms. Bell, second. Any discussion? All in favor? Thank you. Dr. Snowden?
Item number 6, policy revision, testing programs, 4.700. This is a first reading. Per TSBA Director on Policy and Staff Attorney, districts must now provide students with information on available career and technical education opportunities after assessments are administered. TSBA has provided language for our use reflecting this requirement. We recommend approval of first reading.
All right. Is there a motion to approve?
Would this be appropriate to make a motion to approve and waive second reading?
It would.
Okay, let's do that. I'll make a motion to approve and waive second reading.
I'll second.
Okay. Ms. Bell makes motion to waive first, pass on second. And was that you, Mr. Townsend? Mr. Townsend with second. Any discussion? All right. All in favor?
Item number 7, policy revision, teacher tenure, 5.117. This is also a first reading. TSBA Director of Policy and Staff Attorney has given updates to this policy based on recently passed legislation. Due to the cancellation of TN Ready tests during the pandemic, there are no teacher evaluation scores from the 1920 school year. Public Chapter 2 from the special legislative session clarifies that the 2 most recent evaluation scores can be used when determining tenure. Additionally, Public Chapter 378 changes the requirement for providing notice of non-renewal to teachers. This notice must now be sent to teachers by certified mail, overnight carrier, or email so that it will be received within 5 business days following the last instructional day. The model policy has been updated to align with both of these legal changes. The title changes from procedures for granting tenure. References are also updated. We recommend approval.
Thank you, sir. Is there a motion? Ms. Newman, is there a second?
I'll second.
Second, Mr. Townsend. Any discussion? All in favor? Thank you, sir.
Item number 8 is a policy revision, separation practices for tenured teachers, 5.200. First reading. Previously, state law gave the Commissioner of Education the authority to suspend a teacher's license if he or she broke a contract with a local board of education. Under this new change to state law, this authority now rests with the State Board of Education. We have updated the policy to reflect that change. TSBA has provided their model policy for guidance in updating the policy and the references. We recommend approval.
Is there a motion to approve?
Make a motion to approve, and if this is a change based on state law, I would say maybe we waive second reading, as this is not anything we're going to change.
It would be appropriate, in my opinion, to do so.
Okay.
I'll second
Okay, Ms. Newman has made the motion and Ms. Bell has seconded. Is there a discussion? All in favor?
Item number 9, policy revision, separation practice for non-tenured teachers, 5.201, also a first reading. As in the update for policy 5.200, state law previously gave the Commissioner of Education the authority, as we said, to suspend a teacher's license if they broke a contract with a local board, whereas this authority now, as in the previous policy, is rests with the State Board of Education. In addition, there is a change in the way that notice of non-renewal is provided to non-tenured teachers. We've updated the policy to reflect that change. We also have updated the policy, or the references for that policy. We recommend approval.
All right, thank you, sir. Is there a motion to approve?
I'll make a motion to approve and waive second reading.
Ms. Bell, is there a second?
I'll second.
Ms. Newman, Ms. Bell makes a motion, Ms. Newman is second. Is there a discussion? Seeing none, all in favor?
Item number 10, policy revision, homeschool, 6.202. This is also a first reading. TSBA Policy Department has provided this update based on Public Chapter 493. In order to conduct a homeschool, parents must meet certain criteria. Previously, this included having a high school diploma or GED. A change to state law, however, now includes parents with high school equivalency tests, HiSET, in this category. This updated policy includes this additional qualification option. We recommend approval.
Thank you, sir. Is there a motion?
Motion to approve.
Ms. Bell, is there a second?
Is it appropriate to waive second reading on this, Dr. Snowden?
Well, it's not going to change, and I mean, this is a change to state law, so we really don't have the authority to change it in any other way. And certainly it's, since it's by state law, I would think waiving the second reading is certainly appropriate.
Okay, well, let's make a motion to approve and waive second reading.
Ms. Bell makes the motion. Is there a second? Mr. Townsend, any discussion? All in favor? Thank you.
Item number 11, policy revision, alternative education, 6.319. Also a first reading per TSPA. Public Chapter 229 creates another exception regarding assignment to an alternative school or program. Now, Director of Schools is not required to assign a student to the alternative school or program if, 1, the student committed an offense of violence or threatened violence, or an offense that threatened the safety of other students in the school, and 2, the location of the alternative school or program is on the same grounds from which the student was disciplined. TSBA has provided model language to update our policy to include this exception. We recommend approval.
Thank you. Is there a motion to approve? Mr. Townsend, Ms. Barker seconds. Any discussion?
I had a question. Do both of those criteria have to be met for you to not be required to assign a student? I wasn't clear on that.
Well, I want to double check on that. I think if we pass on first, because the way it reads, that means both of them have to be met. Right. And I think that's correct, but we'll find out for certain that you have to have 1 and 2, not 1 or 2.
All right. Any other questions, discussion? Not, there was a motion to second. All in favor? Thank you, sir.
And item 12 was pulled.
Yes, sir.
Director of Schools report. Mr. Chairman, want to go ahead and go into that?
Yes, sir.
Transition of programs, personnel related to Eddie Lane property, and movement of programs personnel from the annex. WEMAC has now fully transitioned to this building from the central office annex. The move went extremely well. And I'll tell you, the WEMAC staff did a great job in preparing their new space and creating a positive and caring environment. And they worked hard. I was over here the Monday after all the boxes were moved over the weekend, I think mainly on Sunday, and it looked like a tornado had been through there, only there was just a lot of boxes, but the boxes were intact. And I came back on Friday, and it was, I mean, a miracle had really occurred. But those ladies did a fantastic job, and if you've not seen that space, hopefully you can get by to see that new WEMAC space. It's just really super nice. We got to figure out how to provide a playground. We're still working on that, but once we get that in place, I think they'll be they're already happy with their new home, but they'll be extremely happy when we get that playground.
Do you have space for the playground already?
I don't know, Dr. Esslinger, is there enough space there?
Is there enough space? Is that the question? We will be creative with our space. There's space. It just may not be as accessible or as close as we would have liked to have been once that parking lot was put in there. But we do have some spaces that we will consider after the pack gets completed and we see the lay of the land a little bit. We'll get a plan around that playground.
Thank you.
Opening day and professional learning day on August the 2nd, our opening of schools program went extremely well, even though we had to stream to individual schools. Our employees reported to their individual schools. Due to the limited parking we had at Poplar Grove because of the construction. Even though we were apart this year, we're excited to have the opportunity, we hope, we think, to have the program next year in the Performing Arts Center. The partnership fair with our sponsors was split up between the schools, followed by our personnel attending the opening, as I said, through live stream from the Teacher Center. Professional learning sessions followed for the most part at their home school. I just have to say, our keynote speaker, Dr. John Hodge, was awesome. He carried an excellent message that we hope was inspirational to all as we begin this school year. He was not only a great storyteller, but the message was important to hear, and we've heard several favorable comments from our keynote speaker. As we have, he is, as I said earlier, I think last month, he is president and co-founder of Urban Learning and Leadership Center, an organization that's focused on student achievement and the reduction in the achievement gap. We had some board members who fortunately could attend. I know many of you were at your paying jobs and you wanted to be with us, but we certainly appreciate those that could possibly be there. As we finished the week, we had district-wide grade or subject-specific rather, and school-based professional learning with administrative day in the week as well. Our meet and greet evening was held on August the 4th with teachers and school administration who were ready to welcome our students and families. And I believe all our principals, assistant principals would tell you that students and parents were excited to be at their respective schools. Our first student day, obviously the half day, was last Friday, April 6th, and then we returned to full days today. Our kindergartners will come one day this coming week and then begin full-time on August the 16th. Our Labor Day holiday will have an early dismissal on September 3rd, and the district office will be closed September the 6th. Carol has provided updates on the conferences, so thanks for letting us know if you have an interest in any registrations. Thank you. That's all I have.
Thank you, sir. Any questions, comments for Dr. Snowden? Not. Any updates from teaching and learning?
No, sir. Thank you.
Thank you. Finance administration?
Yes, you have in your board packets our monthly HR and financial reports. We have started the school year off with a strong sales tax collection report. If you've noticed that we have a 22.7% increase over the same time period last year, that's a healthy increase for our first month of collection, so that's a good thing.
That is. Thank you, sir. Any announcements from board members? Dr. Townsend?
Yes, I just want to say to the people that spoke tonight, thank you. It was showed a lot of passion, both sides of the issue. Your emails, we've gotten all your emails. I read every one. And I'm impressed with the tone that I'm not hearing a lot of the political talk that doesn't really impact me. I'm hearing people telling me their views of what they think the science says. So I think that's important that you realize that as a board, we have not made the decision to think that we are doctors and we can make the decision, and we meet once a month. I gotta tell you, the last time we met, CDC Guidance was a lot different than it was now. If you rely upon us to make those decisions, I don't know if it gets us where we want to go. So I appreciate the fact that we had this session tonight. I appreciate the COVID crew that gets together and works this out, all the people on it. Shelby, you missed out some things that I know that you're on, because I'm on too for my office, and I see you on those same calls. We try to get educated on this. We try to make the best decision we can. So please, I'm hoping we're getting it right, but we're not done yet. We're going to continually work on this. And so I want you to know that don't think what you said, because we don't normally, you speak and we respond to you on the stand. We don't do that. We take it in, we reach out to Dr. Snowden, we reach out to different members of the COVID crew, and that's how we make an impact. But no, your board at this juncture has not made the decision that we think we're the ones who should vote right now today, because we're not going to meet again for another month. So I've heard what we've said. I appreciate it. I've heard what you said. I just want to make sure we tell you we thank you. And of course, all the educators in here that do your job, you've reached out to us as well, and we appreciate that. And it's tough times. I'll say this and then I'll hush so in case someone else wants to speak. Usually, I just think it's best to be as safe as possible. What's it going to hurt? Just be as safe as possible. And if we're overly doing it, there's no downside. People tell me today, Kevin, there might be a downside if you overly regulate this. So I don't think I'm the person. I've got a doctorate. It's in jurisprudence. That's not going to help me out here. But I do think we need to follow the science and the medicine. And that's what most of you said tonight. And hopefully that's what our goal is going to be. And hopefully we'll get it right. But it'll keep moving. And so again, I just want to make an announcement. As far as I'm concerned, I hear you. I read what you said. I'm listening. And I will stay in contact with the views, however my view might be. I wear this because at first there were children in here. I'm vaccinated. I don't wear it for me. I wear it because I don't want to be the person who contracts it. I might be asymptomatic because I've had the vaccine and I spread it to somebody who then will have to deal with that. So I am worried about the COVID, this new variant, but we've got the right people on the job to figure out what this school system should do. So I just want you to know we heard you.
Thank you, sir. Anyone else? Any other board members?
I didn't want to necessarily speak on what Kevin shared, although thank you, Kevin, for sharing that. I wanted to remind us that our Mid-Cumberland meeting is coming up, and it is at Centennial. It's on the 23rd, and I'm really hopeful that they'll give us some additional guidance and information so that we can come back to this, to our board, to our school district, and give them the most updated information that we receive.
Anyone else? All right, if there's no one else, we consider this meeting adjourned.